I'm Rebecca Rectrick from the Arbutus Collective. When we think of eating disorders, we often think of anorexia nervosa or bulimia nervosa. And what is often forgotten, or worse, completely dismissed, is binge eating disorder. Binge eating disorder is a formally recognized and diagnosable eating disorder. It is severe and can cause a multitude of health risks such as osteoarthritis, chronic kidney problems or failure, high blood pressure, high cholesterol, increased risk of stroke, diabetes, heart disease, and is potentially life-threatening. It also carries an increased risk of substance abuse and suicide. It is also the most common eating disorder. It's characterized by recurrent episodes of eating large quantities of food, often in a very short period of time and in secret, and can lead to extreme physical discomfort and pain. It can also be accompanied with a feeling of loss of control, with some people describing an out-of-body experience in which they're no longer able to stop the behavior while it's occurring. An individual may also experience intense feelings of shame, distress, and guilt following a binge. It is not the occasional overeating that many people partake in from time to time. Due to the fact that so many individuals have overeaten at some point, there is a lack of understanding about binge eating, which can prevent a person from seeking support. As with other eating disorders, the physical symptoms are accompanied with psychological symptoms. Common characteristics include low self-esteem, lack of confidence in decision-making abilities, poor body image, anxiety, and depression. These are often accompanied by a preoccupation with eating, food, body weight, and shape. In addition, binge eating disorder can serve as a method to self-soothe when distress tolerance and stress management coping techniques are not well developed. The reasons for developing binge eating disorder will differ from person to person. Known causes include genetic predisposition, environmental, social, and cultural factors. As with other eating disorders, binge eating disorder can affect people of all ages and genders, from any socioeconomic background, as well as any cultural background. And studies suggest that an equal number of men and women are impacted. It is important to understand that you cannot tell by a person's physical appearance whether or not they have an eating disorder, and this includes binge eating disorder. Due to their negative feelings about food and their complex relationship with it, an individual with binge eating disorder will often binge at night or when they are alone. They may attempt to hide evidence of a binge for fear of judgment. Now, the secretive nature of the illness, plus the shame associated with the behavior, often delays a person from seeking support. As with all eating disorders, the earlier the intervention, the closer you are to recovery. If you are struggling or suspect that someone you care about is impacted, seek professional advice. There are a variety of options to choose from, starting with your GP. Recovery is possible, and working with professional support can greatly assist in the road to recovery.